If you have an individual that can't do the deep squat, but yet you want to assess the movement, let's say their limited movement is what's keeping out of it, a heel lift or a hand hold will allow them to sit back on their heels more and still do the squat. And this is important. The heel lift and the hand hold take the ankle out of the maneuver, but they still max out flexion at the hip and knee. And I want to see those joints close down and find out, is this a problem or is the problem down in the ankle? The next maneuver would be closed chain dorsiflexion. The heel stays down and the patient is instructed to bring the knee out as far as possible out over the foot and back up again. And we're looking for symptoms there as well. We also want to look at single leg stance dynamically. So it's the same move, but I'm going to ask you to swing your leg back and forth in a slow, gentle manner, going higher and farther back each time and looking for the responses and the balance strategies that are done. There should be pretty much no upper body balance strategy with sway or side bending of the trunk and no unnecessary flailing of the arms just to maintain single leg stance. Good. If I see a restricted squat on the floor, a restricted motion in closed chain dorsiflexion, yet I see full range of motion on the table with no provocation of pain, I've probably got a stability problem. In a loaded situation, this extremity does not function the same way it does in an unloaded situation, which is the definition of a stability problem. So as a cursory evaluation of the mobilizations, the first maneuver you will do is place the butts of your hand or the inside part of your hand on the medial and lateral malleolus and do an upward and posterior glide. So I'm coming in a scooping motion in this direction, and I'm going to cradle the ankle and have you now come forward with your knee into the same movement. Go as far as you possibly can and back up. The next mobilization will be continuous backward pressure as we did before on the lateral malleolus, but we'll pull anterior, hooking with a hook grip on your fingers on the medial malleolus and stabilizing in this fashion. Come forward and back. The next tape job is basically going to take the lateral malleolus backward, medial is going to come forward. So the tape job looks like this. You tape a fairly high angle so as not to cross over the Achilles tendon at the lowest point. And just spiral and wrap that around. So as you can see, it goes around and winds up, back up there. The second piece grabs medial and pulls anterior, just follows the contour of the foot. Always use your thumb or hook grip to help reinforce the mobilization. And then, once you've got that angle, take the tape down. Just strapping the tape on without imposing that mobilization really makes the tape job ineffective. Now, we use this tape job as a weave, meaning we do one side and then the other just for support and containment. Here, I'll do a mobilization forward with the thumb and wrap down and around. Once again, little pull on the tape, mobilization with the thumb, strap the tape around. On the rear, hook grip, strap the tape around. So what we've gotten is a posterior mobilization laterally and an anterior mobilization medially.